Good afternoon. I'm Lynne Campagne. I'm a registered dietitian from Honored Health Rehabilitation Hospital in Scottsdale, Arizona. And I've joined you today to share with you some basics for staying healthy with Parkinson's as far as nutrition, and hope you'll enjoy my presentation. Just to give you some basics, we just want to go over some of these points in more detail, but this is where we're heading for today's presentation. Just some basics for staying healthy. Most of these things are pretty common, and you probably heard them in other nutritional events before. But for Parkinson's disease, many of our patients here at the hospital we find have difficulties, and oftentimes they hadn't even given it a thought that maybe their diet had something to do with part of their outcome and their process of their disease at the present time. So we like to make sure that you have a good understanding of eating a variety of foods, and also discussing your goals with your doctor at a convenient time for you. We want to make sure that you're considering your weight at the present time. And if you have noticed a weight loss, be sure to make your physician aware of it, because it could be a sign of a progression in your disease. And many people do stop eating sometimes and drinking as well as they should, just because it becomes more difficult. And weight loss is certainly a sign of this. Constipation is also another issue, along with other digestive issues with Parkinson's disease. So we like to touch a little bit today on eating the higher amounts of fiber in your day. And certainly this is an issue that many people say, well, I had that before Parkinson's disease. And we are now finding out that oftentimes these digestive issues were actually a pre-sign of the disease coming onto them. As far as, some good heart-healthy tips, lowering your diet in saturated fat and cholesterol, and trying to limit your sugars on a daily basis, because many of the sugary foods are resources of many empty calories and don't really have any vitamins and minerals in them. Moderating your use of salt. Many individuals with Parkinson's do have problems with low blood pressure, so we just are very light when we mention moderation of salt, simply because it may not be totally necessary for you. So it is, again, another point to discuss with your doctor. Drinking enough water a day, and also if you are a consumer of alcoholic beverages, making sure that they do not interfere with some of your medications. And a good conversation with your physician is definitely necessary. We are often asked from day to day, how do I find out what a good amount of food is that I should be eating, and how many calories should I be eating, how much protein, how much fat, where should my good vitamins and minerals come from? And I often tell people, if they do not have access to a dietitian, to join our wonderful website provided by the USDA called choosemyplate.gov. And if you follow it, you can actually find out, based on your height, your weight, your age, your activity level, and they even address different diseases, what a good meal plan might be for you. But of all else, this kind of gives you a pictorial view of fruits, vegetables, grains, protein, and some dairy every day. And if you can, trying to spread out your meals throughout the day. If you're not able to eat 3 meals, why not try 6 small meals? It often works better that way. Just some key factors as far as nutrition and wellness also. We would like to try to improve your antioxidant intake because of the different toxins that we're exposed to in our daily living. And the antioxidants are generally foods that contain vitamins A, C, and E. Increasing your omega-3 fatty acids in different foods, and we'll discuss those in just a minute. Vitamin D is often a deficiency that we often see in many individuals, and getting resources or possibly even a supplement may be a recommendation. Magnesium is found in many different resources of food, and we'll be talking about that as well because it will aid in your digestive health. Some of the foods that are rich in our antioxidants come to us in a variety of different resources. And hopefully you'll find some here in just some of the suggested recommendations that are things that you're already consuming. You know, any foods that are rich in color, any of the dark yellow, dark red colored foods, dark leafy green vegetables, and of course some of our legumes are excellent resources. Many people don't want to consume too many eggs, or they've been told that maybe it wouldn't be such a good idea because of their cholesterol. And I have always recommended individuals to consume eggs routinely just because they are one of those most perfect foods. And I think they can rely, many people can rely on them for a good resource of protein as well. In terms of omega-3 fatty acids, generally the richest sources of omega-3 fatty acids come from any of our fish that are caught in cold water. Mackerel, tuna, salmon, or trout are really great resources. If you don't care for fish, maybe try different seeds that are out there. And many of my patients use flaxseed in sprinklings on salads and in yogurts, and can even be added to soups just to give your diet a little added boost. And many individuals even take omega-3 fatty acid fish oil supplements. And the recommendation we have there is that if your fish oil supplement contains at least a gram of the EPA or the 500 milligrams of DHA, then they do meet the daily recommended value that we would suggest. Vitamin D. Many of us who live in warm climates and sunny climates like Arizona or Colorado think, wow, I probably have plenty of vitamin D on a routine basis, even if I am not a milk drinker or a food consumer of foods that are fortified in vitamin D. But it's amazing, many of us are deficient in vitamin D in sunny climates simply because of all of the sunscreens that we use. And your doctors are your best resource for getting a blood panel on this. And a good healthy level is noted here in my slide. And if you are low, we recommend at least 2,000 international units of a daily supplement for at least 12 weeks, and then have your doctor retest your values. Magnesium. There are some rich resources in our diet. Some of the salmon and the pumpkin seeds that I mentioned earlier that were your antioxidant foods. Dark leafy greens, whole grains are also excellent resources of magnesium. And many people are familiar with milk of magnesia. Well, one of the main ingredients is magnesium. And the reason it works is because it helps with the digestive process, and it helps to aid the smooth muscles to contract and move your food through your body as it should. And don't feel alarmed at any of this, because we do talk about this to many of our patients, and they're almost glad when we mention, you know, are you having any digestive issues? Because maybe they're just a little reluctant to speak to their physician about it. And if they find that they are having difficulties, they realize that it is a part of the disease process, and many individuals with Parkinson's will have issues in this area. Along with the different magnesiums, you know, we do need to look at the medications that you are taking right now and make sure that when you are consuming foods that you're not interfering with medications that are out there and are used commonly for Parkinson's patients. One of them is cinnamate or levodopa, and this is a protein building block, and it actually competes with other proteins in our body. So the recommendation that we have is that if you do take this medication, that you take it about 30 minutes prior to a meal or 60 minutes afterwards, so that the protein that you do consume does not interfere with the process that this medication works in your own body. A good recommendation too is to get some carbohydrate-rich snacks to help you with taking your medications or helping you with prevention of nausea. We often use applesauce and puddings that help with aid in digestion and swallowing of medications, because as time goes on, sometimes individuals do have issues with swallowing. Some of the different foods or supplements that we probably should moderate have to do with several other drug classifications that are involved with Parkinson's care. Dopamine agonists, pramipexole and ropinirole, don't really require any dietary changes whatsoever. The MAO inhibitors, rasagiline or selagiline, we do have some recommendations here, and we watch foods that are high in tyramine. And these are foods like your cured or fermented meats or fish, aged cheeses, fermented cabbage, sauerkraut, and kimchi would be examples. And then even your soybean products, and this also includes soy sauce. Red wine and tap beer, that's draft beer on tap, can also have a higher tyramine content and would also be interfering with the two medications mentioned earlier. Foods or supplements to moderate also. Iron supplements can actually decrease the absorption of a levodopa medication. So we do recommend that when you are suggested to take one, to be careful and make sure that you take it about 2 hours separately from your levodopa medication. Common problems, we've kind of already touched upon the digestive issues, blood pressure issues, and swallowing problems or dry mouth. Those are very common with Parkinson's disease. And certainly if you're having issues or needing some assistance in this area, first make sure that your primary caregiver is aware, and then also your care provider, your medical doctor that is managing your condition is also aware. And they may actually go through some different suggestions with you, or they may recommend if swallowing problems or dry mouth are occurring and some of the simple techniques are not working for you, you may actually get some excellent assistance with a licensed speech therapist. We've already talked about constipation, but just again as a recap, improving the fiber of your diet and making sure that you do this gradually, and then also improving your fluid intake. And some of the comments that I've made here under high fiber foods, you know, your richest resources are probably no surprise, your fruits, your vegetables, your whole grain cereals, and then also making sure that when you do consume them that you slowly increase fiber to your diet. We certainly wouldn't want you to go from an average consumption of 10 or 15 grams to 30 grams in one day. It is something that you need to slowly improve. And along with that improvement in fiber, a good rule of thumb is to drink half your body weight in ounces of water daily. Low blood pressure. Raising fluid intake can certainly help with low blood pressure, as well as improving the sodium intake with the recommendation of your doctor. eating smaller, more frequent meals so that your body doesn't have so much to require blood for your digestion might actually be very helpful. And I want to thank you very much for letting me share a few of these nutrition points with you today. And feel free to come back to the PMDA if you have any questions. Thank you.